formation. Anjali Mudra. Deep Vishwas. Sangatvam Samvadhatvam ఒక్కసారి పీల్చి కంటిన్యూగా వస్తారు. దిస్ ఇస్ కళ్ళ కపాలభాతి. ఇది చాలా మంది ఈ డిఫరెన్స్ చేయకుండా బస్కి కానీ కపాలభాతి చేస్తారు, కపాలభాతి అని ప్రశ్నిస్తారు. చాలా జాగ్రత్తగా భస్త్రికా में लेना और छोड़ना कपालभाति में सिर्फ छोड़ना है. Now better sitting in. Those who are unable to stand, knee pains or different problems are there for them. By sitting on feet, women sit on chairs or in comfort position and hold the hands in mudra. Now breathe out Shikshivika, neck exercise, breathe in out, breathe out, down. it up. Breathe out down. Inhale up. श्वास लेते हुए ऊपर. श्वास छोड़ते हुए नीचे. Inhale center. Now exhale right. Inhale center. Exhale left. Inhale center. Exhale right. Inhale center. Exhale left. Inhale center. Now touch your right ear to the right shoulder without disturbing the shoulder. భుజాన్ని కలుపుకున్న చెవి ఆనిస్తారు భుజాన్ని. Center. Then left to left. Center. मध्य right to right. कंधे को नहीं हिलाते हुए कान को कंधे से सटाना. Center. Again left to left. Center. Another one is to strengthen the neck. Take the right hand. Keep between your eye and ear. आँख और कान के बीच में रख के opposite में press करना है. Press it. Relax. గట్టిగా తలని చేతి వైపు నొక్కాలి. చేతిని తల వైపు నొక్కాలి. మెడ పైన ప్రెస్ పడుతుంది. Strengthen the neck. Relax. Opposite में press करना है. Relax. Now pick up the hand, then left hand. Press it. Relax. Press it. Relax. Press it. Relax. Now interlock the hand. Back to front, front to back. सर के पीछे दोनों हाथ तల వెనక్కి రెండు చేతులు పెట్టేసి మెడ తలకి మధ్య భాగంలో పెట్టేసి పొజిషన్లో ప్రెస్ చేయాలి. ముందు నుంచి వెనక్కి వెనక నుంచి. Relax. Press it. Relax. Press it. Relax. Now front. నుదుటి పైన press it. ముందు నుంచి వెనక్కి आगे से पीछे पीछे से आगे. Relax. Press it. Relax. Press it. Relax. Now up to down. तला पै నుంచి కిందకి కింద నుంచి పైకి. ऊपर से नीचे नीचे से ऊपर. Same position पे apply it. So strengthen the neck. Relax. Again press it. Relax. Press it. Relax. Then down to up. Up. Relax. Up. Relax. Up. Relax. Down. Hold the hand straight. Finger movement. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now wrist movement. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now wrist rotation. This is called the Adi Mudra. Bottom again in open fitness. Critical fitness rotate. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Reverse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Hold the hand. Breathe in up. Breathe out down. 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 Inhale up. Exhale down. Hold the hand tight. Inhale up. Exhale down. 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 Inhale up. Rotate the shoulders. 1, 2, 3, 4, 5. Viparita correct. 1, 2, 3, 4, 5. Relax. Stand in position. Hold the palms on knees. Rotate shoulders. 1, 5. Reverse. 1, 2, 3, 4, 5. Relax. Both the legs straight. Then let's begin. This position just relax. Now force movement. Weight కదపాలి నెమ్మదిగా. Each movement. Alternate. Now ankle rotation. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Repeat that. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now hold the legs. 1. Even in knee pain, just you can practice it. 2, 3, 4, 5, 6, 7, 8, 9, 10. Now rotation. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Repeat 31, 2, 3, 4, 5, 6, 7, 8, 9, 10. Down. The left leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Clockwise. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Reverse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Hold the right leg. Left leg. Slowly get up. Standard. And same position. दोनों पैर में डालना. Legs together. Both the hand sides. Up. Strengthen your spine, neck, shoulders. ఇది చాలా మంచి ఆసనము. వెన్నుపూసకి, భుజాలకి, cervical spondylitis, neck problem, back pain. Slowly down. Again breathe in up to here, palms facing downwards. Then up. తలకి చేతులు తగలకుండా చక్కగా పెట్టాలి. శతాడాసన. Slowly down. If you are unable to stand like this, just you can maintain the gap. Up. Slowly down. Now Upulala Chakrasana. Keep the left hand up wrist portion, then raise the right hand up. Inhale, bend towards left. Slowly up. Down. The left hand up. Bend towards right. Slowly up. Down. Again, right hand up. Bend towards left. When you are bending towards the right left side, the excess fat which are accumulated here in this posture, slowly down. The left hand up, right side. ఉత్త భాగంలో ఇది రైట్ సైడ్ స్లో ఎక్సెస్ ఫ్యాట్ ఫ్లో నలుగు భాగంలో ఇదంతా ఈ ఫోకస్ కలిగి గులాం చక్రాసన. And then slowly up, down. Not interlock the hand. Up. Gap is just a little bit increase. Now Ustrasana. Then in this position, breathe out, bend towards right side. Center. Then again, breathe in and bend. నడుము భాగంలో ఏదైనా స్టిఫ్నెస్ ఉంటే దాన్ని ఫ్రీ చేసుకోవడానికి జస్ట్ నడుము పై నౌ రొటేషన్ 1 2 3 4 5 6 7 8 9 10 విపరీత ధరణ 1 2 3 4 5 6 7 8 9 10 relax. Now let's together both the palms on knees. Now knee rotation 1 2 3 4 5 6 7 8 9 10 reverse 1 2 3 4 5 6 7 8 9 10 relax. In the same position, balance on your left leg, right leg, front and back. 1 2 3 4 5 6 7 8 9 10 down. The left leg. 1 2 3 4 5 6 7 8 9 10 relax. Now right leg. 1 2 3 4 5 6 7 8 9 10 down. The left leg. 1 2 3 4 5 6 7 8 9 10 relax. After the COVID or the COVID period, will get stressed. मानसिक तनाव होता है, तनाव को दूर करने के लिए मानसिक रुग्णता ఏదో మానసికంగా కొంచెం వీక్ అయి ఉంటారు. కోవిడ్తో కానీ ఏదైనా అనారోగ్య సమస్యలో ఉన్నప్పుడు ఆ స్థితిలో బ్యాలెన్సింగ్ ఆసనాలు చేయడం ద్వారా మనసు పడుతుంది. ఏకాగ్రత పద్ధతులతో ప్రక్షాసన if possible, those who are having deep pain, please avoid prakshasana. It will increase the concentration. मानसिक रुग्णताओं को दूर करता है वृक्षासन. ఏకాగ్రతను పెంచుతుంది, ఆలోచనలను తగ్గిస్తుంది, శరీరాన్ని దృఢంగా మారుస్తుంది. వెన్నుపూస, మెడ, స్పాండైటిస్ ఈ నొప్పులన్నింటినీ తగ్గిస్తుంది. సో we go the hand side down. While standing in this position, please concentrate that your hips should touch the perineum, Mooladhara chakra, root chakra, to activate that. మానసిక సంతులన ఎప్పుడైతే మనం కోల్పోతామో ఆ స్థితిలో ఒకటే మార్గము ధ్యానం స్థితి. ధ్యానం చేయాలి అంటే మనం శరీరాన్ని అనుకూలంగా మార్చుకోవాలి. ఆ శరీరాన్ని అనుకూలంగా మార్చుకోవడానికి మనసును ఏకాగ్రంగా చేయడానికి ఈ ఆసనాలు వృక్షాసన, తాడాసన, నటరాజనాసన లాంటివి చాలా ఉపయోగపడతాయి. బోత్ హ్యాండ్ సైడ్ నెక్స్ట్ part in this position, Kati Chakrasana. Those who are suffering with back pain, neck pain, for this, both the hands straight, get the chest to the chest. Kati bhagamu ante వెన్నుపూస భాగము, नड़मु भागम रीढ़ की हड्डी और कमर दोनों को कटी बोलते हैं. अब हम कंधे को घुमाते हैं, बोथ द शोल्डर. Between 2 feet, 1.5 feet gap, put the hand straight, breathe out, right. In this position, touch your left palm to the right shoulder and look at right side back completely. And inhale, center. Then exhale, leg. Inhale, center. श्वास वदन्तु right. श्वास वदन्तु मध्य. मध्य श्वास वदन्तु left. लेते हुए ये रीढ़ की हड्डी के लिए ఇది भुजाल नाम ఇప్పుడు नर्व भाग में हम कमर को भी घुमाते हैं, कमर का हिस्सा भी जो भी कमर में रीढ़ की हड्डी में पीठ में दर्द है उसे दूर करने के लिए फिर दिन सेंटर विदाउट कमर घुमा रहा है नर्व से सुनाओ नर्व వెన్నుపూస భుజాలు అన్ని ట్విస్ట్ అవుతాయి फिर दिन सेंटर अगेन राइट फिर दिन सेंटर in left present center relax now lie down in shavasana relax in shavasana always after samasana after every asana just relax is compulsory ఒక ఆసనం తర్వాత మళ్ళీ ఇంకో ఆసనానికి మధ్యలో విశ్రాంతి శవాసన శవాసనలో ఎప్పుడు రెండు కాళ్ళ మధ్యలో 1.5 అడుగుల దూరం ఉండాలి నడుముకి అరచేతికి మధ్యలో ఒక జానెడు దూరం ఉండాలి అరచేతులు తెరిచి ఉంచాలి శవాసన మీ శరీరాన్ని నేలకు తగ్గనివ్వకుండా మీరు కార్పెట్ లోపలే మీ శరీరం పూర్తిగా ఉండాలి శవాసన जब आप लेटते हैं तो आपके शरीर के अंदर ही आपका शरीर रहना जमीन को टच नहीं होना है अगर आप हाथ में करते हैं वो अलग बात legs together those who are suffering with shoulder pain neck pain raise the right hand up look at left side stretch the body completely then slowly down left hand up look at right side slowly down again right hand up slowly down left hand up look at right side slowly down repeat it once again right hand up if you are having shoulder problems back pain neck pain please practice this one 3 to 5 times slowly down left hand up look at right side down now move the hands up दोनों हाथ ऊपर రెండు చేతులు పైకి పూర్తి శరీరాన్ని సాగదీయాలి सारे शरीर को खींचना है जैसे हम खड़े खड़े में ताड़ासन करते हैं वैसे शरीर को खींचना है twist the body total nerve system will activate from close to the midpoint of that brahmarasra slowly down once again अब हमारे शरीर में कुल मिलाकर 72,72,72,201 नाड़ियां होती हैं इन सारे नाड़ियों को एकदम प्रवाहित करना है प्रसन्न करने के लिए ये स्थिति या त्रिकासन स्थिति slowly down then sidewise breathe in breathe out inhale those who are having frozen shoulder problems spondylitis for them it is somewhat difficult but gradually by practicing you will get it without raising the hands touch them back down simultaneously legs also apart up down up down up down relax in this position legs apart interlock the hands rotate the hands make a big circle 1 2 3 4 5 whisper 3 से करेंगे. 1, 2, 3, 4, 5. Relax. Shavasana. Shami jaye iti shavasana. Relax. Legs together. Now if you are having back pain and chest pain, then pull the left leg and to reduce the weight. And upon you, now raise the right leg up. Slowly down. 1, 2, 3, 4, 5, 6. Down. Release the left leg. Hold the right leg. The same pattern. 1, 2. धीरे धीरे से उठाना है. 3, 4, 5. Those who are having severe back pain, they can practice like this, raising single leg. Now for the gastric problem, constipation, indigestion, all the system of disorder, Pavana Muktasana. Hold the right leg, press it, Artha Pavana Muktasana. If you are having neck pain, shoulder pain, back pain, don't raise the head. Otherwise, slowly raise the head up, touch the chin, or nose, or forehead. Gradually, head back, leg down, slowly sway. This is a therapeutic method. Those who are suffering with some limit, pull the left leg, press it, touch it. Head back, leg down, straight. Now hold the leg. Remember that if you are having severe back pain, take any pillow or bed sheet or put the hands down like this and then hold them, press them just this way. Don't raise the head. If you are heavy weight or a maximum belly, to reduce the just press them. Apana Pavana Muktasana. Slowly, legs down, relax. To get it from the knee pain, now just raise your legs, both the legs 30 degrees, hold them, and make them straight. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Amrutasana, Shavasana. Now pull the legs up to the knees. अगर आपको ज्यादा पेट है, अपान वायु ज्यादा है, कुछ आसन नहीं कर सकते हैं, ऐसी स्थिति में दोनों हाथ पीछे. Then slowly move the hands up and touch the knee. Come back. 1. Until and unless you are free from the vertigo problem and neck pain. 1, 2, 3, 4, 5. Relax. Relax in the same stiti, or you can relax in Shavasana. Now pull the legs up to the knees. Get ready for Sweet Bandhasana. It's a beautiful asana for back pain, to strengthen the calf muscles, thighs. जो आसन हमने किया है अभी, उसको कंपेंसेटिव आसन, సేతు బంధాసనం. సేతు అంటే బ్రిడ్జ్. బ్రిడ్జ్ ఆకృతిలో, ఒక వంతెన ఆకృతిలో నడుమును పైకి చేస్తాం. If you are general practitioner, you can carry the ankle. Right now, this is theoretical method, so that just keep the hands down and lift the waist portion up as much as possible. जितनी देर हो सकता है आप रोक सकते हैं. 20 seconds, 13 seconds, 1 minute, 2 minutes. Initially 20-30 seconds and slowly down. Again, up, down. In this position, you can take your both the hands back also. Then again, lift the waist portion up, down, relax, Amrutasana, Shavasana. While coming into the Shavasana, in Shavasana, just observe each and every part of the body. पैरों से लेकर सर तक एक एक अंग का निरीक्षण करते जाना है. Relax. Now legs together. Raise the right hand up. Turn to the right side. Slowly come into the Makarasana. Makarasana, toes outside, heel inside. Rest your chin or forehead arching on both the hands. आपके गाल को या टुटी को या माथे को दोनों हाथों के ऊपर रेस्ट करना है. In this position also you can inhale, exhale, inhale, exhale. ఈ యొక్క వేద భాగానికి కూడా శ్వాసను పంపాలి. స్థితిలో టోటల్ ఇన్హేల్, ఎగ్జేల్. శ్వాసని పీల్చాలి, వదలాలి. Those who are suffering with corona, those who are after corona also, they can practice the Makarasana position, inhalation, exhalation, abdominal breathing. साधारण स्थिति में भी हम जब लेटते हैं तो ऐसे लेट कर भी श्वास लेना, छोड़ना, प्राणायाम करना है. आयाम नहीं करना, रोकना नहीं, लेना और छोड़ना. No holding space, just inhale, exhale. When you are inhaling, automatically your chest portion becomes. जब आप श्वास लेते हैं तो पेट में स्वाभाविक से नर्म कमर ऊपर उठ जाता है. Relax. Legs together. Get ready for Ardha Bhujangasana. Ardha Bhujangasana. Elbows and palms lifted up. Your palms lifted up. Up. Ardha Bhujangasana. Elbow to shoulder, it should be straight on this. Concentrate on your lower back. Please की हड्डी क्या से L4, L5 टेपों के ऊपर concentrate करना है. Lower back pain की चाला मंचियासना. Ardha Bhujangasana. Maintain this position for 20 seconds, 30 seconds. Gradually down. Elbows apart and palms together. Once again, inhale with my prashnata ke saath. This is in your regular practice. If you are unable to do all the asanas, pranayama, you don't have time, at least you can practice this one. To avoid the back pain, Ardha Bhujangasana. Down. Now get ready for Sarala Bhujangasana. Both the hands listen up, just to the navel region. Slowly up. Don't raise your wrist posture. నడుము పైకి లేపకుండా పుట్ట నేల కానకుండా ఈ స్థితిలో ఉండాలి. It strengthens total spine. सारे रीढ़ की हड्डी को ऊर्जा देता है. వీపు నొప్పిని చూపించుకోవడానికి ఈ రెండు ఆసనాలు భుజంగాసన్ భుజంగాసన్. Slowly down. Once again, repeat it. Bhujangasan up. Down. Relax in Makarasana. Now get ready for Niralampasana. Back pain, neck pain. In this position, you can do the Shishwasana posture also. In this position, slowly slide your elbows front. Niralampasana. Those who are undergone any surgery or cardiac problem, slowly practice it. And again, once again, elbows front, hips touching the neck. Close. Niralampasana. Slowly back. Release the right leg. Hold the left leg. Again, elbows front. Release the back pain completely. Bhujangasan, Bhujangasan, Niralampasana, Niralampasana, no Shishwasana. यहाँ में अपान वायु में बाहर निकल जाता है. Slowly down. Relax. Shishwasana. శిశువాసనలో ఒక భాగం వచ్చేసేయాలి, అమర్చిన భాగాన్ని మోకాలు టచ్ చేయాలి. అరచేతి మీ ముఖానికి ముందు, ఇంకో చేతి నిటారుగా స్ట్రైట్ పైకి కానీ లేదా కిందికి కానీ పెట్టుకోవాలి. శిశువాసన, బాలాసన, విశ్రమాసన. Change the position. आप जैसे चाहे कर सकते हैं. शिशुआसन. Now slowly let's together. Turn to the right side. Slowly mentally, slowly get up. Come into the sitting posture. And let's repeat. Hold the right leg, left leg. Sukhasana. Sukhasana or Vajrasana. Any comfort position or sit down chair. Now mudra. Some button value, it indicates the Agni Tattva. Index finger indicates the Vayu Tattva. Middle finger indicates the Akasha Tattva. Ring finger indicates the Tattva and little finger indicates the Jala Tattva. To control all the five elements, प्रकृति में जो पांच तत्वों से अग्नि, वायु, आकाश, पृथ्वी, जल, ఈ 5 తత్వాలు మన శరీరంలో కూడా ఉన్నాయి. వీటిని కంట్రోల్ చేయడానికి ముద్రాస్లో ఫస్ట్ వన్ వాయు ముద్ర. దిస్ పొజిషన్ you can chant any mantra or any bijaksana. Just you chant the Omkara 5 times. Take a deep breath. आकाश तत्व రెండో వెలుగు దూసరి उँगली को टच करना है. ध्यान मुद्रा ज्ञान मुद्रा కవి పీడిస్తే అందరూ మానసిక రుగ్మత హృదయము ఇక్కడ హార్ట్ పైన కూర్చోబడుతుంది. ప్రతి ఆలోచన రాగానే హృదయం పైన దాని యొక్క ఎఫెక్ట్ చూపిస్తుంది. కాబట్టి ఇది హృదయ ముద్ర. చూపుడు వేలు బొటన వేలు కొన భాగంలో రూట్ లో పెట్టేసి మధ్య వేలు ఉంగరం వేళ్ళని బొటన వేలు కొన భాగంలో పెట్టేసి ఇది హృదయ ముద్ర. ఈ స్థితిలో కాసేపు రోజు కూర్చోవడానికి ప్రయత్నించింది. ఎటువంటి వార్తలు వచ్చినా ఏదైనా కూడా మనం తట్టుకునేది కనిపిస్తుంది హృదయ ముద్ర. హృదయ ముద్ర only the Anuloma Viloma Pranayama, the thumb indicates the Agni Tattva and ring finger, middle finger. The index finger, middle finger should be folded. ఈ రెండు వేలు మార్చేసి గోముఖ పోస్టర్ అయితే పక్కన ఇలా పెట్టేసి ఇప్పుడు మోసి ఎడమతో షార్ట్ పీల్చాలి. శ్వాస పీల్చినప్పుడు పుట్ట ఉదరం బయటకు రావాలి. దెన్ ఎక్సేల్ ఎడమతో పీల్చి కుడితో వదలాలి. వదిలినప్పుడు నోటికి వెళ్ళాలి పుట్ట, మళ్ళీ పీల్చాలి, మళ్ళీ వదలాలి. If you are beginner for the pranayama, then 1:1 ratio, otherwise 1:2 ratio. Left in, right out, धीरे से छोड़ना है. Right in, left out, left in. Abdominal breathing. Right out, right in, left out. Like this you can practice 5 minutes, 10 minutes. You can practice after the half an hour also. अनुलोम विलोम प्राणायाम आप जितनी देर कर सकते हैं उतनी देर कर सकते हैं. अनुलोम विलोम प्राणायाम. अनुलोम विलोम प्राणायाम. Concentrate on your breath. आपके श्वासों के ऊपर ध्यान दीजिए. जब भी तनाव आता है, टेंशन, एक्रो टेंशन, मानसिक आंदोलन करना, కోపము, అంతఃకరణ స్థితి ఎప్పుడైనా వచ్చినా ఇమీడియట్ గా అనులోమ విలోమ ప్రాణాయామ, ధ్యాన ముద్ర ఆర్ హృదయ ముద్ర. జస్ట్ విట్నెస్ ద ఫిజికల్ కామ్. స్థితిలో కూర్చొని మెల్లిగా అనులోమ విలోమ ప్రాణాయామం కాదు చేసిన తర్వాత మనసుకు దుఃఖపడుతుంది. ఎవరికైతే నిద్ర లేని ఉంటుందో వాళ్ళు కూడా ఈ ప్రాణాయామాలు చేయడం ద్వారా ప్రశాంతంగా నిద్రపడుతుంది. మానసిక రుగ్మతలన్నీ తొలగిపోతాయి. చిత్త వృత్తి నిరోధ, మనసు యొక్క చంచలత్వాన్ని దూరం చేయడానికి యోగ సాధన. Asanas will give you 10% benefit only. Pranayama will give you 90% benefit. So that leads to the pranayama. బ్రహ్మ ముహూర్తంలో లేచి ప్రాణాయామ చేయడానికి ప్రయత్నించండి. అప్పుడు ఆక్సిజన్ ప్రవాహం, ప్రాణవాయు ప్రవాహం ఎక్కువగా ఉంటుంది. చాలా లాభదాయకం. మధ్యాహ్నము, సాయంత్రము. Over to sir.
Relax, sadhakas. Now we have come to the fag end of our program, where we will be taking the awareness program on naturopathic treatment modalities by Dr. S. Sridevi, our senior most faculty of Gandhi Naturopathic Medical College. I request her to conduct the awareness program for COVID-19 prevention, mitigation, and rehabilitation through our naturopathy treatments.
Thank you, sir. Thank you very much.
Good morning, everybody. Good morning, sir. Hope you all have followed the yoga protocol till now and practiced the methods and the practices which have been shown by our yoga guru. Now, I would like to introduce a few naturopathic modalities which would be of great help in the prevention, mitigation, and rehab of COVID-19 and also in some general disorders. So in this process, I would like to introduce a few lines about naturopathy. Naturopathy aims at the eliminative procedures and also the mitigation of the toxins from the body through different procedures. So one of the most important procedure may be the diet and yoga, regular practice of physical yoga and concentration about the dietetics, about what to take and what not to take, and also some of the other modalities. Like among them, today I'm going to introduce you the hydrotherapeutic procedures, which is Jala Chikitsa, by the medium of water that we are going to adopt some of the modalities of naturopathy. So of them, which will be helpful to overcome and also to rehab and prevent also the COVID-19. So one of them would be the facial steam, mukha aviri, mukha bap. So we got the bap which we call in Hindi. So a simple procedure it is existing in our as a traditional system since ages. It's an age-old practice. The facial steam through different herbs or through different powders and so on. One of them, one of the few could be the adding camphor to this boiled water or turmeric, I mean haldi or bitter leaves and so on. So these usually these type of procedures, taking facial steam, steam inhalation, will be of great help to relieve the nasal condition and also the upper respiratory tract. So what is the exact procedure? You have to take um, some amount of water in a bowl, boil them, and then we have to take the precaution to apply moisturizer to the face and take a big towel or some cotton cloth which is bigger in size, and we have to cover ourselves from back up onto the head and some part of the face also, and there should be some gap so that some steam will be let out. And in this procedure, slowly we will be inhaling the steam, which will be helpful to not only to relieve the congestion of our nasal part and upper respiratory tract. There is a belief that this would be helpful to eliminate the bacteria or any other such organisms to prevent the infection, progress of the infection in the body. And also in the during the infected state, the steam will be of great help to relieve the congestion, and also it helps to inhale and exhale properly, which would be of great help for following the breathing practices. So, while following this, apply moisturizer to the face to avoid dryness, and then take the inhalation and exhalation with this in this bowl of water, and this should be practiced for about 10 to 15 minutes. Usually 15 minutes it will be of great help, and after that clean the face either with normal water or warm water, and this is the end of the therapy. It can be practiced for about 3 to 4 times, and during the infected state you can practice one can practice once in 3 hours. So, and as I already told, can be you can add one can add camphor or haldi, that is turmeric, or betel leaves, that is our pan ki patta. So that can be added to this boiling water, which will be also having and carrying some therapeutic effects to the nasal tract and the upper respiratory tract. And the next one is chest pack. So one of the most important therapy of mitigation and rehab of the toxins from the body. Now this actually we practice it with a we have to take one big towel, dip it in neutral water or cold water. So these are different temperatures. Cold chest pack usually we apply for temperatures that is at fever and also in high blood pressure. But a neutral chest pack we generally advise in case of chest congestion and also in mild to moderate temperature. So how let us take up the procedure now. The cotton cloth which we have taken, clean cloth, should be dipped in neutral water. Squeeze this water slowly, and then this should be wrapped around the chest, leaving the hands. One has to raise the hands, and this has to be wrapped around the chest, and preferably a blanket piece should be taken, and that has to be wrapped over this cotton cloth. And this pack has to be maintained for minimum 10 to 15 minutes, preferably 15 minutes. Now, the benefit of this uh, chest pack is in general it relieves the congestion of the chest, upper respiratory tract, and also found to be may not be established fact, but found to be helpful in raising the oxygen saturation in COVID patients, which we have observed in most of the patients. After removing of this pack, that is after 15 minutes, one has to rub over the chest with a normal cotton cloth, which will be helpful to renovate the temperature. And this has to be repeated twice or thrice during the infected state and also in the post COVID state. That is, the patient who has been affected and in the recovery stage can take up this procedure thrice a day on empty stomach, once in the early morning, once in the afternoon, and another time will be in the late evening, maybe after 7 p.m. So this taking of this chest pack, applying the chest pack in the late evening or in the night will be helpful for the patient to have good sleep because he is actually relieved from the congestion of the chest. So it is actually helpful for the helps in the freeing of the breathing. That's how it is helpful for a comfortable sleep for the patient. So that can be repeated thrice a day for about 15 days, even after the recovery, and during the infected state also can be repeated thrice a day and continue till they complete the 1 month of their after their infection. So rubbing of the chest after the pack is also very important. And next, we proceed on to the warm water drinking. So whenever there is an cold or cough, this has been an old practice to drink warm water because this helps in relieving the congestion of the throat. We may be taking some cough syrup. Apart from that, the drinking of warm water also helps as an expectorant because this will be relieving the phlegm, accumulated phlegm from the throat and also from the upper respiratory tract, and the person feels a lot of relief. So for this purpose, the water should be lukewarm, not very hot. So just warm temperature, and it should be minimum of the quantity should be around 200 ml, and preferably this has to be taken early in the morning and before sleep. These two timings are very important because before sleep, of course, it reduces the congestion from the throat and upper respiratory tract. And after raising, that is in the morning drinking of water. Generally, I think most of us we know it helps in not only relieving the congestion of the throat, but there is another important factor that is cleansing of the intestines, which is very important in maintaining a healthy respiratory system. Because if there is accumulation in the intestines, if the intestines are not cleaned properly, that would have an upward pressure and the patient may develop the breathless. So for this purpose also, drinking of warm water is of much helpful, and these two timings are inevitable and one has to follow this during the infection and also in the post-COVID was to totally relieve from the infection. And also, that one can drink the warm water during the daytime also, that is before the meals, half an hour before the meals, and around the evening around 4 o'clock. This warm water drinking can be practiced for the better results. So these procedures, anybody, not only for the COVID patients, these are helpful for the mitigation and rehabilitation of the COVID-19 patients, but also these procedures are of much helpful for patients who are suffering from bronchitis, asthma, and also tonsillitis in children. If anybody can come across of these conditions, can also practice for these with these practices. So another procedure that is along with warm water drinking, COVID-19 patients can follow the salt water gargling, which is already advised for most of the patients. So the salt water gargling also helps in the elimination of the toxins released by particular bacteria or virus, and also the bacteria or the virus also can be eliminated from the system because the salt water is supposed to remove the eliminate the bacteria, and hence the salt water gargling also can be practiced by this particular patients tonsillitis, bronchitis, and also post COVID-19 patients. During the infection also salt water gargling is of much helpful because this helps in the the reduced activity of the virus. So once again, I repeat, these procedures are of much helpful in the prevention, mitigation, and rehab of the COVID-19 patients. Thank you very much for giving me chance to talk on this, and also thank you one and all.
Thank you, ma'am. Thank you for your short and sweet presentation. Uh, I think all the sadhakas might have followed the treatments. So I would like to add two important points to the presentation of our speaker. One is regarding the salt water gargling. So whenever you have COVID-19, the symptoms of the COVID-19 are cough and cold. So naturally, when you have cough and cold, that is the infection is limited to the upper respiratory tract. So you have cough means you have throat congestion. So salt water gargling, because you add a pinch of salt in a glass of water, lukewarm water, and then you gargle. So what happens is, if any virus is there in the upper respiratory tract, that is your throat, so it will be washed out. So, and because it is a warm water, your congestion of your throat also gets relieved. So it helps in two aspects. One is the congestion is relieved, and the virus also will be flushed out. So that is one important aspect. And then one more treatment which I would like to add to our naturopathy modalities today, in addition to our speaker's presentation, is hot foot bath. So usually what happens is, in COVID-19 patients, you have headache sometimes with fever. So you can relieve that headache very easily. What you have to do is, you take a small bucket or a tub. You have to just pour some lukewarm water up to the ankles level. You have to place your feet and then see that your ankles are dipped in that water, your feet and ankles. So that will help a lot in relieving your congestion. So the headache will be relieved within 10 to 15 minutes. So that is also one treatment. But before taking this hot foot bath or lukewarm foot bath, so bearable temperature you can call it. You can take hot water or lukewarm water, which is bearable temperature. Okay. So then you can place your feet. So the precaution is, you need to take a glass of water before going for this treatment. And one more aspect I would like to add to our speaker's presentation is the facial steam. What Madam has specified is very helpful in increasing the oxygen saturations. So we have been following the COVID care centers, which have been run by our naturopathy doctors. So we have observed that the oxygen saturations are improving when you give the facial steam. It's an important observation. So the facial steam can be taken for improving the oxygen saturations also. It is very helpful. So with this, we'll conclude our session today. I request our yoga gurus, Nilima and Girish, to conclude the session with Shanti Mantra.
Both the hands in Pranamasana, Anjali Mudra. Get ready for Shampa. सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामयः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत् ॐ शान्ति शान्ति शान्तिः. The forming. Keep on your eyes. Slowly open the eyes. Look your palms to the Namaskara, then to the Guru Namaskara.